Diagnosis of tuberculosis is never-ending sort of endeavor. The empty clinical scenario at times fail to give real diagnosis. So the next step is looking for the sputum. Sputum can be induced by gastric from the gastric secretion, from the jet nebulization, the saline inhalation, and chest percussion. Three early morning gastric stomach aspiration and examining for the AFB and by the culture. Yield is not that high, 20 to 15%, but should be done in almost all circumstances when you are not certain with other maneuvers. And then finally at times you may fail, you reveal there is no growth, no microscopically, no with the mycobacterium, no growth even. It takes 3 weeks for the growth and another 3 weeks for the sensitivity in the Lowenstein Janssen media. So you cannot wait the 6 weeks at times. So you can go for the next step, the PCR or nuclear net. Your it looks for the DNA sequences of Mycobacterium. Sensitivity is variable, 25 to 85%. Specificity is quite high, 80 to 90, 100%. So Gene Expert MTB CAR-Ts, it's a real-time PCR. And RIF, the rifampicin CAR-Ts, it looks for the rifampicin resistance. So you get the two informations. One, the detection of the Mycobacterium. Two, its sensitivity. So you get the MTB CAR-Ts, this gene expert result by within 2 hours. Sensitivity is not that bad, 70 to 80%. Specificity is around good, is very high, it's around 99% or so. In adult, in children a bit low. In India, even in induced 60 to 70% variable. And then next step may be the expert ultra. It is a replacement of microscopic almost. Here, the it is the possible cellular cases are being detected, and the MT negative cases can be detected. And the next generation assay sensitivity is not bad, 70 to 70% plus. And so WHO recommends you use the Gene Expert Ultra. You use your uh, uh, Gene Expert MTB and Riff Curtis and Sputum combine along with TST and set clinical scenario to diagnose tuberculosis. At the end, everything might fail. You may go for the therapeutic trial. In the American Academy of Pediatrics, they recommend if everything fails, you have compatible clinical scenario, you do go for a therapeutic trial.